would love to hear your thoughts, suggestions, or comments.
I mean, I just wanted to say that I think that what you've done is extraordinary, and having access to something like this would certainly be beneficial. I know how laborious it would be to add the PEDS piece, but I think that that is a huge need because that's an area that often gets missed. And yeah, I just want to say thanks for doing this. And
Yes.
Yeah, absolutely. Absolutely. I mean, I'm curious, related to the PEDS though, does capturing babies or children just doing various functional activities in non-optimal ways, is that a good place for us to start from your perspective?
That's a good question, as opposed to looking at pathologic. I think it's nice to see variability, and maybe a way in which a child moves that's efficient versus a way that's perhaps less efficient but not necessarily pathologic. I find that, fascinating, and I think oftentimes that's again, something's missed. We look at what's typical and what we expect based on what they say is typical, and then we look at pathologic and we miss the in-between. And so, as a pediatric faculty member, one of the things that we do frequently is just tons of observations in daycare centers and around typical kids, so those students can start to see the variability of what's considered to be typical. But it's so that's definitely a good place, I think, to start, and eventually moving your way into pathology would be great.
Yeah. I wonder if we brought babies in and tried to do common functional tasks that are age appropriate and just to capture that systematically, so that at every month, regardless of the pathology, we would try to capture the baby being enticed to do certain functional activities. Just that collection alone, I think, would have its own value, because then you could connect that to more specific testing or intervention strategies. It creates a context again.
Right. And I think, again, there's a lot of videos that I can find on babies, but once they hit that 1 year mark, there's a huge gap. So even thinking about the toddler stages, when really gait doesn't mature until they're 7 years old. So how do they look different, but yet still not pathologic? So looking at that 12 months through 5-year-old and how jumping looks different and walking looks different and getting up off the floor looks different based on the different stages.
I have made a note of that, so we will keep filming. We were completely exhausted after 12 months. And then, month by month, baby's turning, he's changing, we've got to capture him. And then, and now you're 12 months to 5 years, I can see my future already written. So, but you know what? We love this kind of thing. And, the impact is big. I mean, all of these apps are being translated into multiple languages, so we can impact learning all over the world. So the work is worth it for sure. Great comment. I will make that known to our PEDS faculty. Any other thoughts or comments related to the neuro dysfunction, movement dysfunction app, or even the functional movement app? And the thought of actually using the phases as we've described, the same design as the gait app. Any other thoughts?
No, I really like it, and I like that you have lower thoracic, different from lower lumbar. I know it's hard to lump them together because the mobility is different. So I know when you're having that conversation, trying to figure out, do we, piece them apart? Do we put it all together? And I do like that they're identified differently because the mobility is different. But yeah, I mean, I don't think I have any suggestions on anything to change from that perspective. I think that what you've done is pretty extraordinary.
That's excellent. Well, I thank you so much for your comments. I want you to know that every faculty member who is here, including if your colleagues want it as well, have full access to all of our apps and all the evolving apps. If you log in at PhysioU.com, You use your faculty email. Your password is password. And what we've been trying to do is we are continuing to continuing to release. We've got a PNF app that's right around the corner that we filmed with one of our alumni who now teaches at Kaiser Vallejo. And we have a new, actually Sarah Kraft and I are trying to, she has some amazing work that she's done related to neuro rehab. So patients and testing and interventions tied to the neuro patient, all of that is coming. So the neuro app, or the neuro part of the app, is becoming very rich with a lot of great content that I think will make life much easier for the faculty and for the students. So just so that all of you know that feel free to reach out to me anytime. Mike@PhysioU.com. This is where you sign in, by the way. As ideas evolve, now that you've seen what we are doing, we love getting comments and thoughts from the faculty because we can continue to grow and change it. It's ever moldable, put it that way. That's why I built it in this format. There's no new additions. It just keeps getting updated. And for the students, if you are ever interested, the students can come here to the website and they have options to get it at less than a cup of coffee a month. And what that supports is all of these new apps that are coming. Medical screening, neuroanatomy, wound care. We're dreaming of a game for wound care, therapeutic exercises. There's a lot of amazing stuff that's coming. So I just want, yeah, go ahead, James.
Talk about the cost and the value, Mike, is that for that $450 a month, I mean, all subsequent advancements or updates are included. I mean, it's not like another $450 or anything. It's a, you know, the subscription is, you know, in perpetuity for them, and that way, right, they can have it. Yeah, and so any updates on any of this stuff.
We've thought very carefully about certain textbooks that we don't use anymore because the app could do it better, and any one textbook you eliminate pretty much covers the app access for the duration of a program. So, you know, it comes out to $54 a year. The students get billed annually. Nevertheless, I just want to end on saying thank you for being a part of this and for being contributing your thoughts, and would love to stay in touch. If you have thoughts, comments, things that you think need to be built, we're always interested in connecting. All of these apps are built by faculty. And so if you have a specialty area that you think apps, we always try to decide, is apps the right way? So we don't build apps for everything. But if there's something that comes across your mind, please feel free to reach out to me, Mike@PhysioU.com. So thank you, everybody, for joining us, and have a great afternoon, and stay in touch.